Dr. Debashis Maikap, rheumatologist, KIIMS Bhubaneswar. Today I am here to speak about pulmonary hypertension and its management. November the month for awareness of pulmonary hypertension. Pulmonary hypertension can affect anyone irrespective of the age, sex, race or any ethnicity. Usually the symptoms often mimic other pulmonary condition and heart condition like COPD, asthma or any heart diseases. The symptoms usually are shortness of breath or breathlessness on exertion, chest pain, palpitation on exertion, syncope like faintness or dizziness, leg swelling, and sometimes patient develop loss of appetite. WHO classifies pulmonary hypertension into 5 groups. The group 1 usually involves pulmonary artery, otherwise known as pulmonary arterial hypertension. The causes are drugs, inheritable causes, and CTD like systemic sclerosis and MCTD. Group 2 involve the left heart disease like rheumatic heart disease and other valvular heart diseases. Group 3 involve lung, usually ILD, other hypoxemic condition. Group 4 usually involve the pulmonary arterial obstruction, that is either because of clot or any thrombus. Then group 5, which is miscellaneous because of multifactorial causes, either including some metabolic causes like some storage disease or hematological disease like sickle cell or thalassemia. Then investigation. The investigation usually will do some blood investigation to reach a particular autoimmune rheumatic disease or any other systemic disease. Then I will do some lung test like HRCT thorax, pulmonary function test and 6-minute walk test. Then cardiac test like ECG, echocardiography to see the evidence of pulmonary hypertension and any strain pattern. And lastly, patient may require right heart catheterization for confirmation of the diagnosis of pulmonary hypertension. These are the tests we will commonly do. Then treatment. Usually there is no cure for the pulmonary hypertension. Often patient managed with medication. The prognosis depends upon the group of pulmonary hypertension. The best prognosis is group 1, that is pulmonary arterial hypertension, where we can use pulmonary vasodilators like phosphodiesterase inhibitor, endothelin receptor antagonist and prostaglandin analogs. Then sometimes patient develop heart failure, so here we use heart failure medication like diuretics, digoxin as well as beta blocker. Then patient lastly require oxygen, sometimes home oxygen therapy for long term, and lastly lung transplant or heart lung transplant. And now research are going towards stem cell therapy. And first another thing is what are the primary diseases like systemic autoimmune rheumatitis should be treated with proper immunosuppression so that the pulmonary hypertension will not progress. What are the instructions to be followed? First, patient should quit smoking, avoid heavy weightlifting, and should not travel long journey, and take proper vaccination like influenza and pneumococcal vaccine. Should not conceive, should practice contraception as pulmonary hypertension is not good for pregnancy. It is a very high risk pregnancy, so should discuss with your doctor before planning for pregnancy. Then in the diet should take less salt and less water if the cardiac involvement is there, and properly follow the instruction of the doctor and take proper medication and visit the doctor frequently. Thank you.